Ontario is culturally diverse and has an aging population, pressing the province for an enhanced end-of-life strategy to improve communication, decision-making, and care. Due to its growing immigrant population and multicultural demographics, Ontario faces a barrier to improving end-of-life care through its need to address cultural differences. Aside from language barriers, an absence of a common background due to a lack of shared knowledge and understanding between healthcare providers and patients makes engaging in end-of-life conversations a difficult task. To solve these issues, the McMaster Health Forum has proposed that education and training be provided to healthcare professionals to facilitate culturally appropriate communication to ensure understanding and informed consent. The 3I framework will be used to illustrate the impressively favorable prospects for this option.
Looking into the government structures in Ontario, the Liberal Party currently has a minority government, such that the Conservatives and the New Democratic Party collectively hold the power to prevent legislative changes. However, all three parties have agreed on the importance of a committee to investigate end-of-life improvement, meaning that the threat of this veto point is nullified. Furthermore, decision-making on educating providers on culturally appropriate care will not require the involvement of the federal government, improving the prospects for change. Considering the effects of past policy, we see that civil servants already have the administrative capacity to introduce education programs for healthcare providers. In addition, educating healthcare providers is not a highly visible or traceable change because it would not involve changes to the core bargain, leading to minimal opposition from the public. The current policies therefore offer a low-resistance path for the implementation of this change.
The interest groups concerned with end-of-life communication training all exert their influence but don't have a seat at the decision-making table. Powerful healthcare professional groups, including the Ontario Medical Association and the Registered Nurses Association of Ontario, are motivated by the concentrated benefits of improved clinical practice. Both groups have supported the increase in end-of-life conversations, with the Registered Nurses Association of Ontario even promoting this in their end-of-life best practices program, evidencing their commitment to mobilizing on this issue. Citizen groups like the Ontario Coalition of Senior Citizens Organization have participated in talks about increasing communication in end-of-life care, which indicates their willingness to mobilize. Additionally, the Minister of Health and Long-Term Care, Deb Matthews, is a powerful elected official who advocates end-of-life care issues.
It's really important that people talk to their loved ones, that people talk to their family members about their end-of-life care so that they do put that advanced care plan in place so that their wishes are known to their family members if they're not actually able to express those wishes themselves. I can tell you that providing the best possible end-of-life care is a very big priority for us.
Clearly, the presence of concentrated benefits for powerful interest groups heavily drives forward the prospects for this option.
Looking into the dominating ideas, we can see that the need for culturally appropriate communication in end-of-life care is supported by a rich pool of research evidence. This evidence indicates that healthcare professionals find it hard to break bad news to patients, especially where culturally appropriate healthcare is needed. The highest quality systematic reviews have shown that communication skills training for end-of-life care is effective in improving healthcare professionals' skills in addressing this challenge. Training healthcare professionals in patient-centered approaches leads to positive patient satisfaction and beneficial effects in their care. The research support for this option is positive and strong, but public ideas carry substantial weight as well. Canadians estimate that 54 hours per week would be needed to care for a dying loved one in the home. It's no wonder that opinion polls have revealed that 8 in 10 Canadians agree that planning for end-of-life care should occur when they are healthy. This shows that the public wants physicians who are educated in helping them make their end-of-life decisions.
One apparent obstacle for the prospects of this option is the concern that only 9% of Canadians report having spoken to a healthcare provider about end-of-life issues. It may seem as though educating providers in communication skills will be fruitless if so many patients are not discussing end-of-life issues in the first place. However, the goal of training providers is to prepare them to initiate these conversations with patients, which thus remedies the problem. A second obstacle that challenges the prospects of this option is the fact that interest groups cannot directly influence policy decisions and can only act in an advocacy role. This concern is greatly countered by the extreme imbalance of interests in favor of the option, combined with support from powerful individuals who are already within government, including Minister Deb Matthews.
To summarize, the prospects for the option of educating and training healthcare professionals to facilitate culturally appropriate communication in Ontario are remarkably favorable. The absence of veto points and low visibility of change provide a low-resistance path for change to occur. Powerful interest support from the Ontario Medical Association and Minister Deb Matthews are driving this change forward. Additionally, knowledge from the highest quality research evidence and opinions of the public call for culturally sensitive end-of-life care. Despite minor obstacles, such as the restricted power of interest groups, it's easy to see that education programs for healthcare providers to promote culturally sensitive end-of-life care will soon become a reality within Ontario.